Well, hello, and thank you for joining. My name is Brian Lease. I'm a physical therapist here at Westfields Hospital. I've been at this facility for 14 years. I know that sometimes posture is not the most exciting topic, but it is important for all of us to keep in mind, especially if we're having aches and pains that we might associate with some postural problems. Posture is important for various reasons. Our posture can affect our symptoms. It can cause pain if we're in a prolonged poor position. It can also affect our function. If we're in a poor position for a long time, we can develop some stiffness, and that can lead to the inability to do our normal activities or get into a normal position. It can cause muscle stiffness and joint limitations. We'll talk about each body part separately and how poor posture can affect our function and what pains might result from that. And then I'll also go through some exercises that we can do to correct the postural faults through each body part. All right, so starting at the neck. So poor posture in the neck can cause headaches. Usually the headaches start from the back of the head and can wrap around to the frontal area up above the eyes. Poor posture at the neck can cause neck pain or mid-back pain, and it can also cause arm pain or numbness and tingling down the arm. If your neck is in a bad posture, it will affect the range of motion of the neck. So this slide there says a protracted position, which we'll see a picture of in the next slide, which is basically mean our head is forward. And when your head is forward, that will affect our ability to turn the head, so which can affect our function, turning to see while driving or looking to see behind us. And it will affect our ability to look up. So imagine drinking from a can or trying to look overhead. If you're in a bad posture, you won't be able to have full range of motion with those activities. So there's a picture of somebody in a protracted position. So you can see that their head is forward. What I typically will show clients in the office is if I drew a line straight down from her earlobe, that's going to be well in front of her shoulder. And typically we like to have that earlobe bisecting or in the middle of her shoulder. So being in this position or being slouching and sitting will make it more susceptible to be in this forward head posture. Other things that can lead to this posture might be visual problems, so trying to strain to see what's on your monitor, or sometimes in icy weather, we kind of strain while we're driving, trying to get as close as we can to that windshield to see where we're going. So there are some exercises that we can do to help improve that forward head posture. So the chin tuck exercise that's demonstrated in the picture on the right is a very common therapy exercise. It's often done either seated or lying down on your back. That helps to strengthen the muscles in the front of your neck and can stretch the muscles on the back of your head, which can directly help to reduce headache symptoms. So one disclaimer here is that sometimes exercises are prescribed and done in the clinic and may not be beneficial and may actually cause pain. So if you try any of these exercises and they make you worse, make sure you discontinue that and either talk to your doctor or your physical therapist. So sometimes doing this chin tuck exercise can irritate a nerve root problem and cause some pain down the arm. But typically for a postural problem, this is a very common exercise prescribed by physical therapy. Another exercise that's not shown here is turning your head side to side through a comfortable range of motion. So in a neutral position, so having your head back, just turning your head to the left and right, maybe 10 or 15 times in each direction, and then also side bending your head to the left and right through a comfortable range of motion. And then gradually over time, as you work on rotating or side bending your head, you'll gain some range of motion in that neutral position. So another body part where posture is often a problem is the shoulders, and typically this can go hand in hand with neck posture as well. We call it in therapy a forward head rounded shoulder posture. So bad posture in the shoulder can lead to shoulder pain, of course, but also can lead to arm pain and numbness and tingling, just like the neck. and then it can also cause some problems through the mid-back. Functionally, with postural problems in the shoulder, we may have limited range of motion overhead, which can affect your ability to do things like throwing a ball or swinging a tennis racket. So here's a picture of forward head, rounded shoulder posture. And again, these two tend to go hand in hand pretty frequently. And then on the right side of that picture, you can see her shoulders are now pulled back and her head is in a better alignment. So and a lot of these problems will go hand in hand, and we talk about the lumbar spine and the hips here in a minute. You can see her posture probably isn't good throughout her spine in that left-hand photo. So sometimes correcting one will correct more than just one body part. It will correct the whole spine. So some exercises that you can do for shoulder problems, that rounded shoulder posture, would be some exercises lying on your stomach or in that prone position. So there's 6 different exercises shown there on the right side, and the gentleman there is just doing it against gravity, no weight needed. A lot of the exercises that I'll go over here the rest of the webinar can be done either against gravity or can be done with some resistance, either through exercise bands, dumbbells, weight machines at a fitness facility. So lots of different ways to do the same exercise. I like doing exercises in prone or on your stomach because it doesn't require any equipment. And a lot of us really don't tolerate being on our stomachs very well, and I think over time just practicing being in that position can help strengthen your upper back and work on your hip flexibility. So lots of great things can come from being on your stomach. If you don't tolerate that position at all, though, we can do these exercises through other means. All right, so the next set of exercise is some strengthening for the shoulders. A very common therapy exercise is external rotation. So it's starting with your hand at your stomach and then rotating your upper arm, and your hand will move off to the side. So you'll see kind of the start and end position in those 2 photos. The one on the left, the gentleman is using resisted bands, and on the right, the lady is using a dumbbell. Both of these are beneficial. Sometimes there's a reason to do one versus the other, but they're both great exercises for shoulder external rotation. And that helps to strengthen the muscles on the back of your shoulder and help hold you in better alignment. For all the exercises, we really want to do slow, controlled movements and have a good posture through your shoulder blades as you're doing all of these shoulder exercises. And that's pretty consistent for all of the exercises. Again, it's better to go slow, control the weight, control the movement versus trying to work through the reps as fast as you can. And then here's some photos of some stretching exercises for the muscles on the front. So with that rounded shoulder posture, we tend to be tight on the front and weak in the back. So most of the strengthening was geared toward the muscles in the back, and the stretching is geared toward the muscles in the front. So you can do a stretch against a wall or in a corner, or lying on your back over a foam roll or a towel roll. There are lots of different ways to do the same exercise. So it might be your personal preference, it might be what equipment you have, it might be your therapist or physician preference as well. So lots of different ways. If you try one of these and it doesn't work for you, there's lots of different ways to try it. Typically with stretching, we have you hold for 20 or 30 seconds or longer. That prolonged stretch can help the muscles elongate and stay elongated after the stretch. Excuse me. So the next body part that I talk about is the thoracic and lumbar spine. Kind of lump those two together as the spine tends to work similar with the stretching and the strengthening. So pain obviously can affect the mid and low back, and also can cause some leg symptoms or numbness and tingling. And then functionally, if you're really in a bad posture, it can affect your ability to walk. And if you're slumped over too far, it's going to affect your vision and ability to see what's going on in the world in front of you. So we do want to prevent functional changes, and then long-term postural changes can actually cause the vertebrae to deform and making it harder long-term to maintain a good posture. So then moving on, some examples of posture on the left there. There's multiple different postures that the lumbar spine and thoracic spine can demonstrate. So a lot of these have specific names. So you might hear the word sway back or flat back or lordosis. An ideal posture in the lumbar spine is a slight inward curve in that lower back, and then for the thoracic spine is a slight outward curve of the mid-back. So those two curves should kind of cancel each other out, and you end up with a pretty upright posture. The picture on the right shows an ideal seated posture, and I talk frequently to our staff here at the hospital and with patients about making sure your chair is able to support you in an upright position. It's really hard to maintain an upright seated posture throughout the day without that external support. And so really important to have a chair that is able to meet you where you want to sit versus leaning back into a very flexible chair where you end up leaning back more than you want to. So sometimes in the classroom or in therapy we'll have people sit on therapy balls, and that can be helpful. But without that external support, it's really hard to maintain that throughout the whole day. And then lots of different exercises for the core and the lower back. So here's an example of a strengthening exercise for the low back. Just lying on your stomach and raising your head and chest up will work the lower back muscles. Again, that prone or on stomach position can be very helpful to stretch things out and strengthen things. With the really young kids, when sudden infant death syndrome, a lot of times people are afraid to get infants on their stomach. And developmentally, we found that it's very beneficial to get kids on their stomach. Now, you may not want them to sleep there, but throughout the day and during play, it's very important to have youngsters on their stomach. And even for us older adults, getting on our stomach can benefit a lot of different things. All right, so some other exercises for the core would be some simple abdominal exercises. So the picture on the left is an example of just a core tightening or abdominal bracing. There's a muscle called the transverse abdominis that we try to activate in that position. And then there's many different exercises or ways to progress the exercise, but just being able to contract that muscle initially is half the battle, and then you can progress to doing leg lifts or arm lifts in that position. It may be hard to recruit the right muscles in this position, and that can be affected by abdominal surgeries or pregnancy. And so you may benefit from having a physical therapist actually kind of walk you through that if you're having trouble. The picture on the right shows an unstable position, so a hands and knees position, and then doing leg lift and arm lift. And having that unstable position will help to maximally recruit multiple muscles to help stabilize that spine. Therapy ball, as I mentioned in sitting, can also be used to help recruit lots of different muscles throughout the core. And then some stretching things that you can do. The picture on the left shows a stretch for the latissimus muscle, a big muscle that courses through almost the entire back. And then another stretch more for the spine on the right, using a foam roll to help stretch that thoracic spine backwards. So that's a pretty aggressive stretch. That may not be something you want to try if you have osteoporosis or have a hard time getting in and out of that position. Certainly you could use a towel roll that's not quite as thick, would be a gentler stretch. And then moving on to the lower extremity, looking at the hips and knees, and I kind of lump these two together, although for the exercise part we could probably pick out 100 for each of these. But one interesting difference that I see, at least in the hips and knees from the upper body, is that I feel like postural problems are very common in the neck and shoulder, and those postural problems can lead to muscle weakness and tightness. Whereas in the hips and knees, it can work that way, but it can also be the reverse, where weakness in the hips can lead to postural problems. And so strengthening of this body part is very important. And you'll see functionally how that can affect, how the function can affect your alignment. So Pain-wise, hips and knees, you'll oftentimes get hip bursitis if you have weakness in the hips. And if you have bad posture during functional tasks in the knees, you can develop some patellofemoral pain, which would be pain in and around the kneecap. And functionally, that can lead to difficulty with any weight-bearing activity like squats, moving from sit to stand, doing stairs. And so here's an example of some hip weakness causing some postural problems. So in the picture on the left, you can see how the foot, knee, and hip are generally in good alignment. And then on the left side, her knee is caving in to the inside of her body. And that's probably due to some weakness in the hip, or it could be weakness in the knee or ankle region. And then other postural problems, picture on the left demonstrates what we call Trendelenburg, where that right hip, lower back is dropping when she's weight bearing on the left. And that, again, is a sign of hip weakness through that left hip. So we would want to strengthen that left side to prevent that from occurring. And having that repeated Trendelenburg or drop of the hip can cause bursitis on that left side. Can probably cause other problems in the knee and ankle as well. So sometimes positional, there are some positional causes for tightness as well. So the picture on the right shows a lady in a hospital bed, and her knees are bent, and this is often done to keep patients from sliding down in the hospital bed. But you can also see that her hips are slightly bent. And if you're in this position for a long time and you're sitting and you're standing and you're not fully upright, that's never really stretching out the muscles on the front, and that can lead to postural problems as well. So that's where lying on your stomach from time to time can really help stretch out things. And again, not the most comfortable position for many patients, but can be very beneficial. So some exercises you can do for the hip and knee, mostly showing the hip, but we can do a lot of the knee exercises as well, doing things like squats and lunges. A lot of the fitness facilities have knee machines like a leg extension or leg curl. And we'd really want to do some emphasis on the hamstring if we're going to focus on that knee joint. So the exercise on the right shows hip extension, raising your hip up against gravity, and that's going to help stretch things on the front, but also strengthen the muscles on the backside. So we also want to work the muscles on the side of the hip, and the photo on the left there shows some resistance band around the ankles. And as you walk forward or sideways with that band, you have to work against that resistance of the band, which will help strengthen those muscles. And then the series of photos on the right, lying on your side, raising your leg up against gravity, or using a band to work on that as well. And then the single leg bridge and photo C is very good for the core and hamstring and glutes. And then that's a side plank on photo D, and that's also good for the core. And you can vary how you're doing that to work some of the other hip muscles as well. You can do that bridge exercise on photo C with a therapy ball to add some instability. That starts to make it very difficult, but if you're a higher level patient or athlete, you might be able to do that. And then the last body part I go over is the foot, and that can affect foot pain, of course, or ankle pain, but it really can affect everything else as well. So if your feet are not in good alignment, that will affect your knees and hips and can affect your lower back, and then all the way up the chain, so all the way up into the neck and shoulders. And functionally, of course, it's going to affect any weight-bearing activity, so walking, stairs, or even just standing. As far as exercises for the foot, so the question marks there, so there are a lot of different exercises that we'll do for ankle strengthening and balance, but I'm not sure that a lot of the exercises for the foot have been shown to change your foot posture. There's an exercise called the short foot exercise that may be able to strengthen the intrinsic muscles of the foot, but it's a pretty challenging exercise. And again, I don't know if you have a really bad flat foot, if that's going to totally correct that problem. So sometimes we need to use some external support like orthotics, wedges in the shoes to help correct those postural problems. So although we'll definitely recommend some strengthening and probably some stretching, and that might help part of the problem, it may not totally solve the issue with the postural problems in the foot. But as mentioned, it's very important because that can affect everything up the chain. And doing balance exercises, so single leg stance on the floor, using a foam, sometimes using some external devices like a ball just to play catch, so it kind of takes your mind off of what you're doing to make that more automatic. I have given this talk to a senior group at our local fitness facility, and I got lots of different questions about how many reps or how many sets of exercises they should do, or for particular injuries, what kind of exercises. And it's hard to show all of the different exercises in a short seminar. If you have any specific aches and pains that you want addressed, it may be good to check in with your physical therapist or a doctor to make those exercises unique to you. I generally tell patients to do the exercises once a day, try to make that more of a habit. And so if you're consistently doing those exercises over time, they should help. I also tell the patients not to expect that the exercises are going to correct any problems in a day or two. They really will take weeks to change your posture and help improve your strength. Imagine you have a sore shoulder. It's going to take a few weeks for those exercises to completely change your posture and strength. So we did get a question about a stiff neck. Going over the neck real briefly again, postural problems in the neck are mostly this forward head posture that is shown in that posture, where the earlobe is lined up in front of the shoulder. And one of the most common exercises we would do for that would be this chin tuck exercise, where you pull your head back and try to stretch out the muscles in the back of your neck. And then if your neck is stiff with rotation or side-to-side movements, then we would just have you actively go through that full range of motion, or as comfortable in a neutral position to try to stretch out that neck. A therapist or chiropractor might do some manual techniques to try to increase the flexibility. But if we're trying to stretch the muscles, just actively going through that rotation or side bending can be very helpful. And sometimes using overpressure either with your hand or a towel or something can help add to that stretch. There's muscles in the upper shoulder, the upper trap, and levator that therapists might show you some specific stretches for those, and that might help with your neck stiffness. It might be looking down to the left and holding on to a chair with your right hand to stabilize that shoulder. So those are a couple exercises for your stiff neck. Thank you for joining us.